Hi everyone, Dr. Patel here with Hillside Medical Group. Hope you're having a wonderful day. Let's talk about diabetes. Given the holidays just around the corner, you know you're going to be eating a lot of sweets over here, which is going to not necessarily help our blood sugar so well. So let's talk about diabetes, okay? Majority of our patients are in type 2 diabetes, which is insulin resistance diabetes, treated initially with the medication, followed by, depending on how what the readings are and how uncontrolled it is, we treat it with insulin. How do we diagnose diabetes? Many times patients come in with vague symptoms of fatigue, tiredness, going to the bathroom a lot, urinating a lot, feeling very thirsty, just tired all the time. When we do our annual labs, that's one of the part of our annual screening is to check your blood sugar and check your what we call 3-month average blood sugar, which is A1C finding. When the A1C finding is above the normal, sometimes in between pre-diabetic range, of course the recommendations are going to be to work on diet and exercise, try to lose some weight, watch your diet. If we're not able to accomplish our goals of going from pre-diabetes to normal, then the provider may recommend on considering to start a medication. The goal is always to work on diet and exercise, improve lifestyle modification, and try to get you off of medication if you're on medication. Now, said that, some patients just become so resistant to insulin, or their body becomes so resistant to insulin that medications are required. At times, more than one. Besides diagnosis, then when it comes to treatment, of course, as I said, lifestyle modification is the first thing that we like to try. Everyone likes to try, all medical community. When patients fail, then we go on to medications. Metformin being the primary medication, and then after that there is categories depending on what your A1C levels look like. Awesome. Another question that frequently gets asked is how frequent are the labs done? Normally, after you start a new medication, there is a chance that depending on if it's toxic to your kidneys or liver, for monitoring purposes, the provider may order a lab in a month, but otherwise, traditionally, labs should be done every 3 months, and patients should be seen every 3 months for monitoring of their blood sugar level, but also to make sure that you're not having any side effects. Finally, last question is how often you should be seeing your provider. You should be seeing your provider every 3 months to monitor, because many of these medications can be toxic to your kidneys or to your liver. So it's in your best interest to monitor this on every 3 months, check your sugars every 3 months, and of course adjust the medications as it becomes necessary. Last question I get asked is, I've been on this medication for 4 years, 5 years, 10 years. So why do I still need to get this frequent labs done? Because as you age, your organs age, which means if you started a medication 10 years ago, great, and you've not had any challenges with it, which is even amazing. That's exactly what we hope for. But then your kidneys, your liver has gotten 10 years older, which means the medication that you feel and have gotten used to being so safe, we need to monitor it even more closely because your organs may not be able to clear it out. Think of it as your plumbing system. When your house is new, great, all the plumbing lines and everything is great. Maybe you do annual checkup and everything will be okay. But as your house gets older and older and older, your electrical system needs a more frequent monitoring. Your plumbing system is not functioning as well as it you did in the past. Our body theoretically is no different, right? So as we get older, our organs continue to age, which means it's actually even more concerning to us as physicians and providers that we like to keep an eye out on your organs even closer, because chances of a small little infection or trauma or something, trauma as in even consider dehydration in our summer of San Antonio, that can tip you over to having a severe kidney failure or liver failure. Only having the medication makes it even worse. So I hope this helps. To summarize, we diagnose you for diabetes on our annual screening. Once the diagnosis is made, first and foremost, diet and exercise is what we love for you to do. But if we're not able to reach our goals with that, then of course medication becomes necessary. Monitoring should be done every 3 months, regardless of how long you've been on this medication. And then insulin is usually resorted when the levels are so high that we need to bring those sugars down sooner than later. I hope you have a wonderful day, and I hope this is helpful.